Welcome, I'm Steve Edwards, and I'm honored to serve as President and CEO of Cox Health. This is being filmed on April 8th, just a day before we open up the entire state to eligibility for vaccines, those 16 and over, for the SARS-CoV-2 virus. I know that many of you are thinking, I'm not sure I wanted to get the vaccine. I want to encourage you with some safety and efficacy data, a little background around the vaccines that we've discovered. First, I want to talk about a man named Paul Offit. He's a physician. He's a pediatrician at Children's Hospital in Philadelphia. He has spent his whole career studying immunology, virology. He actually invented, one of the co-inventors of the rotavirus vaccine. Rotavirus is a disease that kills about 600,000 kids a year. And one of the things that he caught my attention early on in the pandemic, he said that beyond all the trial data, all the efficacy and safety data, we still hold our breath for the first million vaccines administered. We've now administered 700 million in the world, 110 million in the United States. I know that we've at Cox done 75,000. It has remarkable safety data. As a matter of fact, it's hard to find a vaccine with better safety data in the history of man. I know at Cox, we've had, of 75,000, we've had only one severe reaction, and that was a patient that has a list of maybe 10 allergies and did have an allergic reaction. There's an anaphylaxis moment. We took that patient to the ER. Within 2 hours, they were released back home safely. So very good safety data on this vaccine, and also amazing effectiveness. I imagined that if we were able to develop a vaccine, that maybe its efficacy would be 40 to 60%. What we found out with Moderna and Pfizer, its efficacy is 95%, and 95% against both mild and severe disease. But we've also discovered it's 100% effective against severe disease, hospitalization, and mortality. It's also true of Johnson & Johnson. It's a little bit less effective against mild disease, but that's probably because it was targeted in its trials in areas that had the known variants. The variants are a little bit more elusive and harder to prevent. But at the same time, it also is proven to be 100% effective against severe disease, hospitalization, and mortality. So you may be thinking, though, I'm young and I have a very low risk of dying from this disease, and that's absolutely true. There's randomness to this disease. We've lost someone as young as 31 at Cox. We've had people as young as 21 on a ventilator. But the math is such that it affects disproportionately older people. And to give an example, a person over 80 of color is about 800 times more likely to die from this disease than someone who's in their 20s. And so it does disproportionately affect older people. But the bothersome thing about it is what we have found out through studies that about 75% of the spread of this disease happens with people under the age of 45. And so we're asymptomatic, we're more likely not to know we have it, and we think we're at lower risk. But what we're doing is we're spreading it to elderly people, and so those over 45 represent 95% of the deaths. And so why get it? There's 3 or 4 important reasons. One is protect yourself, because we know that we can turn this disease into something like a complicated cold. If you get the vaccine, you're not going to be in our hospital with COVID, and that's the most important thing from us. There's also this understanding that we're learning about long hauler syndromes, or these sort of long-term effects of this virus. It does tend to affect our cardiovascular system, our neurovascular system. We are learning that there may be more and more long-term effects from this virus, and so even though you may have a asymptomatic experience, we're still finding people with cardiovascular events far after this associated with the disease. And then maybe to me, more importantly, most of us were brought up with a belief or faith system that called upon us to serve others, to be unselfish. And if we know that if we get a vaccine, the likelihood of us spreading this disease is cut down materially, we ask you to do it because our faith, our belief system, tells us to look out for others. So to conclude this, I want to share a story that breaks my heart about a physician, Dr. Michael Bennett. He had a practice in Greenfield, Missouri. Dr. Bennett graduated from the Cox Family Medicine residency program in 1999. I actually was at his graduation. He was an advocate for keeping his community safe, an advocate for masking, and his community wasn't always ready for that and not always supportive of that, yet still he advocated for that. He got death threats from time to time. He continued to take care of his patients, even though they declined to mask. And even though he used the right safety mechanisms, being exposed to that many people that didn't mask, he eventually got the COVID virus and the disease. We think he got it probably in the latter part, at least symptoms showed up in the latter part of December, which makes it all the more heartbreaking because he was probably within days of being able to get a vaccine that would have protected him. He ended up being hospitalized. He was on a ventilator for 50 days, and on March 6th, at 52 years old, he succumbed to this disease. I don't want those of you that can get a vaccine to not get it because I want to save your lives. I want our community to be stronger and safer. And so if you've got the vaccine, great for you. If there's loved ones in your family or other loved ones that haven't, please encourage them to. We want to get our community strong. We want to get our community more back to normal. We want to protect and keep the ones we love safe.